Hi, Dr. Kuratola. Hi, Dr. Jorgensen.
Hello, thank
Hi,
you for having us on.
Thank you
Steve.
both for joining us.
Steve, I got you. I think you got the long bio from my
That's
office.
exactly what I thought. I'm like, stop reading. That's
I was
enough.
like 1982 to 85. I'm like, I'm old.
Yeah.
Yeah. Okay, well, in case people didn't know you, so okay,
Excellent.
so thank you both for joining us. We both, dentistry is always a funny subject because we used to not discuss it. And then whenever we had anyone discuss dentistry, we were flooded with questions. So we are very interested in having you, and it still is a topic that a lot of us seem very challenged about. Most of us, unfortunately, have to deal with this topic, and we are kind of don't have a lot of great sources. So it's great that you two have explored alternative ways to handle dentistry, and you're sharing them with us. So thank you both.
Thank you.
Our pleasure.
Okay, so not to be a troublemaker, but let me start out with a question just that is a little off topic, but I want to ask it anyway. We're having a 17-day conference. There are 81 speakers. There are 85 sessions. There are 32 panels. To the best of my ability, it seems like these speakers are good. They're credentialed. They've studied things. They've written books. They've gone to universities and got degrees. They really seem like experts. And virtually every one of the ones who speaks about health and nutrition is saying a whole food plant-based diet is the ideal diet for health. And I know both of you have while this is not your focus is dentistry, you have said, or Dr. Jorgensen last year said, that her experience with vegans was not that it wasn't the ideal diet. And Dr. Curatola, in your book, you had mentioned a different diet. So everyone has a different experience. I'm wondering why all our speakers are coming to the conclusion that this is the way to proceed, and what has happened to the two of you in your experience that you're not recommending this unless you've changed your mind in the last year.
Yeah, I mean, if I could, Steve, since you mentioned the book, I think it's really important, and I've never been a supporter of a one-size-fits-all approach in diet and nutrition. I think the principles are important. In my book, which I happen to have, the Mouth-Body Connection, I wrote this book to really enlighten the lay person, but I have many dentists. They write me and went, "Wow, I learned so much in the book." Well, I talk about 4 cornerstones of oral health. The first is nutrition, and what I talk about is a AAA diet. So it's not a particular food selection, but it's the principles. AAA stands for alkalizing, anti-inflammatory, and antioxidant rich. AAA. And we find, and what I found in 40 years of practice, is that is the most conducive to promoting what we call balance or microbial homeostasis of the oral microbiome, which I studied for 25 years. Is that people who have a more alkaline, people who have a lot of antioxidants get burned up in the mouth. That's vitamin C, CoQ10, all these very, very necessary nutrients that are important for proper cell function. So I think it's not so much that, oh, I'm a vegetarian, I'm a ketotarian, I'm a pescatarian, I'm an anything-atarian. I think it's really important to find that whatever food groups, there are some people that I have observed that don't do well on plant-based. I happen to like it. I just came back from a 4-day vegan diet retreat and I'm going down to Hippocrates soon. And I do fine with it, but there are other people who need organic, grass-fed beef and whatever. So alkalizing, anti-inflammatory, antioxidant rich is the moniker that I use in the book.
Thank you.
And I really like to go back all the way to Dr. Weston Price in the 1930s. And Dr. Weston Price was a dentist. Not a lot of people know that he was, but a lot of people in the nutrition circles talk about Dr. Weston Price and the research that he did and the things that he found. And what he found, or what he was studying, first of all, is he was studying the correlation between health and diet. And he went to all these indigenous societies, which honestly, we couldn't do today because there are no indigenous societies on the face of the planet that haven't been touched by the modern diet. So he was in the sweet spot where he could find these indigenous societies, places that hadn't had the diet that we eat today, that is common in our societies today. They hadn't had that diet change yet. He went to these places and he wanted to see what were they eating. And then what was their health like? And he was looking at everything. He was looking at growth and development. He was looking at teeth, of course, because he was a dentist, but he was looking at bone development. He was looking at prenatal and postnatal development for both the parents as well as the children. He was looking at so many things. And what he found is that there was a correlation. It didn't matter if they were eating whale blubber in Alaska or grass-fed butter in Switzerland. There was a correlate between all of the foods that equated to healthier people. And what it was fat-soluble vitamins. That was the key finding that he found in the 1930s that has still stood the test of time to today. Fat-soluble vitamins. And what are those vitamins? They're vitamins A, D, E, and K. Those are the fat-soluble vitamins. And so just by name, what we have to understand is a fat-soluble vitamin is found in a fatty food. It's not found in a water-based compound. So I'm not going to be able to take a piece of spinach and have fat-soluble vitamins because there is no fat in the spinach, if that makes sense. There are other things that are in that spinach. There's fiber, there's antioxidants, there's all sorts of water-based vitamins, but there are no fat-soluble vitamins. They're only in fat-containing foods. So that's the challenge that I find in vegans, is that they struggle to get enough of these fat-soluble vitamins, which are found in fatty foods. So what do those fatty foods look like? Which ones do we recommend? Well, Dr. Weston Price was recommending cod liver oil. Kind of an old thing that not a lot of people want to do these days. But the reason he was recommending it is because it was high in these fat-soluble vitamins. And there's scores of research showing that particularly vitamin D3 and vitamin K2 are essential for tooth development and bone development both. Those are key components. He didn't know what to call vitamin K2. It actually wasn't named at the time he was researching it. He called it Activator X. And we've since renamed it as vitamin K2. You have to have those things. And there's a little bit of a misnomer because people say, oh, well, greens are full of vitamin K. That's vitamin K1. That's a clotting factor. That's not the same thing as I'm talking about. Vitamin K2 is necessary for bone growth and for tooth development, for tooth strengthening. You can't find those in only plant foods. That's the challenge. I am all for plants. Like, I'm a huge gardener. I love plants. I will eat plants all day long, every day. But you cannot get every single nutrient you need in a plant if you don't have some fat-containing food. And that's animal fats. It's vitamin D from the sun, but not a lot of us get a lot of vitamin D these days. So that's what I'm saying. That's one of the challenges. The other challenge is the way these things are handled. There's a lot of information. I'm a huge gardener, huge cook. There's a lot of information about the way we handle grains, about the way we handle greens. I have a patient who was eating greens almost exclusively. So she was having a huge green smoothie in the morning, huge green salad for lunch, and a huge, portion of greens in the evening. And she literally, her teeth were dissolving away. And we had no idea, couldn't figure out what it was until I finally got to the root of her diet. What are you eating? Oxalates are a huge problem with dark leafy greens, and oxalates bind calcium. Well, calcium is an obvious necessary component of teeth and bones. So if you have a lot of oxalates in the diet, it's actually going to pull calcium from bones and teeth. She was literally dissolving her teeth because of the greens she was eating. So I don't have a problem with greens. I love them, but they have to be handled properly. They have to be used in correct amounts. I believe moderation in all things is a really important thing as well. I'm not going to go eat steak and bacon every single meal, but I'm also not going to eat, 3 pounds of greens every meal. I don't think that that's the way nature intended us to eat. I think we are supposed to eat a little bit of everything. And that's really the reason that I find that vegans struggle with food or with tooth health is they just aren't getting those fat-soluble vitamins that are necessary to grow teeth and bones. They just don't get them. So that's where I'm coming from.
So just to follow up. Go ahead.
No. What I was going to say is that, I'm glad Michelle brought up Dr. Weston Price. They're really, most dentists do not know who he is. And he was recognized as the Charles Darwin of nutrition. And he actually founded the research arm of the American Dental Association. And I'm a strong proponent of those fat-soluble vitamins as well. And while many of those can be taken as a supplement, and many of those can also be taken and are available in vegan diets and other diets as well, There is, pescatarian as well. You get omegas and cod liver oil comes from cod. Not the most palatable, but it is definitely vital. But Weston Price was way ahead of his time. His book Nutrition and Physical Degeneration should be read by everyone. And but I do kind of stand by the fact that there are patients who do perform better on vegan diets, and there are patients who do need to be plant-based, during stressful periods in their personal journeys in health and things that they may be facing. So, and I've seen, everything from the China study and other books that have made it very clear that there is and Brian Clement, who I'm sure you have on the program, is a brilliant naturopathic doctor who is really fiercely. He wouldn't even put my book in his bookstore because I had multiple diets like with Arctic char and different things. I agree that there needs to be the right fundamentals, but you can get that from different diets as well.
So just to clarify, are there vegan foods we could get these fat-soluble vitamins like seeds, nuts, olives, avocados? Or can we still get those from those foods? Chia seeds, flax seeds, hemp seeds, walnuts, pecans, are those fat-soluble vitamins available in them? Or are you saying that you'd have to eat an animal product?
Vitamin E is what those fat-soluble vitamins is. The fat-soluble vitamin that are found in seeds and nuts is primarily vitamin E, not vitamin D and K. That's the challenge, is that they're very difficult to get from plant sources. And so, like Dr. Kuratola said, you can supplement them. And that's what we do for most of our patients is we supplement them because you can't get them from primarily plant sources.
Yeah.
They're difficult to get from those sources.
So, for example, the product that I developed, Revitin, it has actually all of these it's D3 and K2. We just got a vegan certification. So we did find, by the way, Michelle, a vegan vitamin D3.
That's great.
Yeah, so it's getting more sophisticated, but supplementation is important. I totally agree with fat-soluble vitamins. One of the biggest sources of tooth decay in children is the lack of fat-soluble vitamins in their diet.
Okay. And then just to clarify, for oxalates, we just had Doug Evans on talking about sprouts, broccoli sprouts, and all the benefits. A lot of, he's suggesting eating lots and lots of sprouts. I don't know if sprouts have oxalates or only certain dark greens, but should we be eating raw greens and raw sprouts, or have you personally as dentists, was that just a one-time thing that a person had that problem, or is this a common thing that people eat too much greens and there's a negative consequence to their teeth?
So what I found is that it's all just moderation. I look at the earth and I say, okay, is 6 cups of greens a day available in December where I live? It's not. And I believe the earth gives us a little bit of cue. What should we be eating and how much should we be eating? Is a cup of greens enough? Yeah, I think a cup of greens is probably enough. So there are ways to mitigate oxalates. You can cook the greens, and that actually does mitigate the oxalate. You can also, what I do is when I make a green smoothie, what I'll do is I add a calcium lactate tablet to the green smoothie. I just blend it right up with the smoothie. And what that does is it binds that calcium rather than binding my own cellular calcium. And so there's ways to mitigate it. Absolutely. The darker the green, the more oxalate content there is. So if you're talking about a broccoli sprout, you're not going to have nearly the oxalate content you do as you have, as a big, dark green leaf of spinach. So the oxalate content varies by the green, and each one has a little different amount.
But as that patient you had, has that happened numerous times, or was that a one-off?
No, we actually see a lot of people that have oxalate issues. It doesn't just affect their teeth, it affects their bones. You see arthritis situations, arthritis symptoms based on oxalate buildup. Again, it's just knowing. That's the challenge I find with a lot of dietary advice is we give these, like Dr. Curatola said, we give these one-size-fits-all recommendations. We should just all eat so many greens. We should eat, this many greens a day. You know what? That may not be okay for everyone. That isn't necessarily a good recommendation for everyone. We have to say, well, what is in that green that needs to be dealt with properly, that needs to be handled the right way? What is in that grain that we're eating that needs to be dealt with the right way and handled properly? There was a reason that they used some soaked, fermented, sprouted things, because it inactivated what's called the phytic acid or the phytates in the grains. If you're if you're eating a vegan diet, again, I have nothing against this diet whatsoever, but you just need to understand there's problems with each of these foods if they're not handled properly that can affect your tooth health. You just need to understand what you're eating and why you're eating it. That's really what I'm saying. I don't believe any diet is bad or wrong at all. You just need to understand what you need to do to make that food the best for your cells in your body.
Okay, thank you. What is, in general, just so before we go into more detail, what is the daily, weekly, monthly, yearly day oral hygiene that the two of you recommend? What what exactly is the advice you're telling people? How many times should we brush? Should we floss? Should we use a water pick? Should we get cleanings? How often? Should we, what is the basics of dentistry that you tell everyone who wants to take good care of their teeth?
So, Steve, the brush twice a day and see your dentist twice a year, that was made up by the toothpaste companies. and that was never anything scientific. It was just marketing. I think Procter & Gamble used it. See your dentist twice a year, this and that. Meanwhile, what we know is the cycle for people with active periodontal issues is, it's better to intercept the progression of the disease on a 90-day cycle, which is once every 3 months. And so it'd be 4 times a year. And I think anybody over 25 to 30 years old really should move into a quarterly maintenance cycle with a dental hygiene program. Unfortunately, people who rely on dental insurance to cover that, the dental insurance companies are still in the dark ages and giving reimbursements that were given back in 1962. So what I recommend with patients on a daily basis, first thing is, most, and I don't want to sound like a shameless self-promoter here, but most toothpaste was developed by soap makers 100 years ago, 150 years ago. It was flavored detergent for your teeth. And what we have learned in the past, when I started studying the oral microbiome in 1998, and what we discovered was radically different than what Michelle and I were both taught in dental school. And that is that the oral microbiome is not this invader and kill it, like, Listerine kill germs on contact and Colgate Total kill germs 24 hours a day. The oral microbiome is a beneficial, intelligent, literally, it's being classified almost as a new organ, the oral microbiome, the gut microbiome, and it does amazing, amazing things for remineralization of teeth, for oxygenation of the gums, for the elimination of free radicals. So the most important thing is to balance and keep this environment in balance. How do you do that? First of all, get rid of products that disturb the microbiome. Alcohol-based mouthwash, detergent toothpaste, even natural toothpaste, unfortunately, many of them have no science, and they've come up with things like charcoal and this and that. Charcoal, scratch it. It binds to everything, by the way. We use charcoal when we take mercury fillings out of the mouth. But if you use it in a toothpaste, it's stripping the microbiome every day, in addition to scratching tooth enamel. So there's so many products that are bad. So what you really want to do is feed your smile, feed your microbiome. And we're talking about nutrition. Well, one thing I learned back in 1999 is that the oral environment is a very beneficial environment for absorbing things like vitamin C, CoQ10, vitamin E, vitamin D3, K2, ionic minerals, and all these things. And that's what we really need to do. There was a study from the 1970s by a Japanese researcher who biopsied diseased gums, and he found two major nutrients that were necessary for proper cell function. Vitamin C, number one. If I had to throw every vitamin out of my bathroom cabinet or refrigerator and keep one, it would be vitamin C. That is by far the anchor for vitamin needs in the body, and we burn a lot of that. B complex, of course, the B's are really important, but it's just important in terms of a daily routine to make sure you do no harm, you do good. So I was on Dr. Oz talking about, had a whole thing on, do you floss, do you not floss, do you floss? And I'm like, because it's very popular right now to use all kinds of new interdental products. Because, what I said on Dr. Oz, which is, everybody laughed, it was true. I said, the place where unhealthy plaque forms first is between the teeth, interproximally. So I said, think of it like this. Your mouth is 98 degrees. So think of tenement buildings in New York City, and people put out the garbage in between the buildings, and that's where the rats go. And so and that's where the rats come out. And the rats are all kinds of periodontal pathogens and spirochetes and all this other stuff that forms when the microbiome is out of balance. So what you really want to do is make sure you take that garbage out and get it picked up. So that's where interdental cleaning is important. Dental floss was developed as a simple, because the contacts between the teeth can be very tight. So dental floss was created not to snap down to your gums between your teeth. Most people don't even know how to floss, or they hurt themselves when flossing, so they don't do anything at all. And they say, "Oh, I don't floss." They lie to the dental hygienist and all that stuff. The important thing, again, is if you use floss, that you gently slide between the teeth and you lasso gently the adjacent teeth. You don't snap it down to the gum. There are all kinds of, as I said, other great devices. I am a big fan of water flossers. I have my own water flosser. I love it for three reasons. It is gentle. It removes food and debris between the teeth, and it also provides for microcirculation, hydromassaging of the gums, which I also think is very good. But those things, what we know is that twice a day when you wake up in the morning and go to bed is more than sufficient. And I'll let Michelle take it from here.
No, this is awesome. I just tell people 7 minutes once a day. Really, it's what you need. 7 minutes just in total. And talking about tooth products, it's really important what you put in your mouth. Fluoride's a problem. Huge anti-fluoride thoughts on my side. So you're
not alone. Fluoride. You're not alone, Michelle.
Exactly. I don't recommend fluoride. Basically, cavities are not a deficiency of fluoride. It's one of my favorite things to say. Cavities are not a deficiency of fluoride. So we don't need to put something on the tooth that was never there. We need to put minerals on the tooth. And that's what we need to put back on the tooth to actually help it to be healthy again. So I recommend a non-fluoridated mouth care product. Again, everything that Dr. Kuratola is talking about, no detergents, nothing that you wouldn't want to eat, basically is what I talk about. Toothbrushes, people always say, well, what kind of toothbrush should I use? For me, it's the one that you'll use. It's the one that fits most and the best in your mouth. It's the one that actually does the best work for you. And it needs to be soft bristled. Hard bristle toothbrushes are to clean your toilet and clean the oil off of your driveway. And that's it. So soft bristle toothbrush, something that goes between your teeth. I don't care if it's floss or a water pick or a water flosser. I don't care what it is, as long as it cleans the garbage between the houses, and cleans it out. And then the last thing I add is a tongue scraper, because a tongue scraper is like a shag carpet, and it is what collects a lot of the things in the mouth, particularly fungus. So if you're having issues trying to keep candida at bay, trying to keep your yeast issues at bay, check your tongue. And people say, oh, no, I brush my tongue. I'm going to give you a challenge. I want you to brush your tongue with your toothbrush, and then I want you to scrape your tongue with the tongue scraper. And you're going to be shocked to see that there's still all sorts of disgusting things coming off of that tongue scraper after you've scraped it. This is an old Ayurvedic technique from India from thousands of years ago. And it is absolutely imperative for balancing the microbiome that Dr. Curatola was talking about. I just saw a note. I hope they mentioned a specific brush. I love, it's called Burst. It's a specific vibration, a very gentle vibration with an electric toothbrush. Honestly, like I said, the one that you're going to use is the best toothbrush for you, the one that's going to fit in your mouth well, and the one that's actually going to clean your teeth. So when you finish, you shouldn't feel scum. You shouldn't feel that stuff on your teeth. Their teeth should feel smooth, and then you're done. That's all you need to do. So that's what I recommend people to take about 7 minutes a day.
But you're
So
saying,
I want to add something to what Michelle said, because she opened the Pandora's box on fluoride.
I know.
And
I
just
tried to
want to
not open it very wide.
it's time for it to be opened real wide. There's
Yeah.
over 62 studies that drinking fluoridated water lowers IQ in children. There is over 20 studies showing the correlation of drinking fluoridated water and osteoporosis in people, a major osteoporosis problem. I want everyone to go to fluoridealert.org for all the science-based literature on fluoride, because unfortunately, and I'm sort of very disappointed that dental schools are still teaching junk science on this. And I'm old enough to say that. And I can tell you, I'm a member of the clinical faculty for many, many years. I also gave a major naming gift to New York University to name the Kuratola wing for clinical research, which is dedicated to translational research on the oral microbiome. So I am a big fan of good science. And good science has shown that fluoride has done nothing to reduce decay rates here, and what most of Western Europe was never fluoridated, and they have same or lower decay rates. As a matter of fact, we have fluoridated communities with higher rates of decay in the United States than non-fluoridated, including the state of New Hampshire, which is not fluoridated, and per capita has a lower decay rate. So fluoride is unfortunately a big topic. I have a daughter who started dental school, and I asked if they were feeding her the fluoride rigmarole, and she raised her hand because she's educated and awake, and she actually was getting jumped on by the other students who were like brainwashed and thinking you need fluoride. Fluoride is not a nutrient. It is not a nutrient, as Dr. Michelle shared, that it is not necessary to mineralize teeth. You don't need fluoride to mineralize teeth. So it's time to get out of this. By the way, the final thing I'll say, since I really blew open the door here on fluoride, is that the physical properties of fluoridated teeth and bones are about 33 to 35% weaker than natural teeth and bones. Natural teeth and bones are made of a mineral called hydroxyapatite. And when you introduce fluorine, fluoride's a made-up word, it quickly, because it's so negatively charged, it changes your natural teeth and bones, which have some more tensile strength. They have a little bit of flexibility, and it changes it to fluorapatite, which is much harder, like this glass. But if I drop it on the floor, it'll break in a million pieces. So it's harder, but more brittle, less tensile strength. So people need to wake up and do their own science, do their own research. Go to fluoridealert.org is one of the best consumer advocacy organizations on this issue. And we need to kind of take a really good look at a failed public health experiment of the last 75 years.
Thank you. Michelle, just to clarify, for a lot of us, teeth brushing, dental cleanings, flossing, this is all part of our routine. A lot of us do tongue cleaning. Are you saying this is like a friendly suggestion, or are you saying this is as important as any of the others?
I think it's as important as any of the others, because it's where a lot of these pathogens and other things live. They just stay there. So there's something called geographic tongue. And a lot of our patients come with complaints of this geographic tongue. It has these patchy moving spots all over the tongue that are very sore, especially when you eat acidic food, those kinds of things. I suffered with geographic tongue for years, all the way through college, through dental school. My tongue was so sore. I couldn't eat pineapple. I couldn't eat tomatoes. I couldn't eat any of these foods. And I finally, not even thinking there was a correlate at all, someone recommended, you ought to tongue scrape just because you're a dentist. Why don't you figure out, why don't you start doing this? So I started tongue scraping, and it was sore as can be when I started because my tongue was just sore. And then I kept at it. And after about 2 weeks, geographic tongue went away, and it has not come back since, except for one time when I was pregnant. That's it. So what that tells me is that was, I believe, a fungal infection. I believe a nonstop fungal infection that's creating an immune system reaction in the body, showing up as this geographic tongue, which dentistry says is idiopathic, meaning we have no clue what causes it. Okay. I absolutely have a clue because it was a personal experiment of my own. I think it's fungal, and I believe that the body cannot be balanced. Your mouth can't be healthy, and you can't be healthy while your tongue is not cleaned.
So I want to add to that because Michelle, I agree with you in that it is often related to an imbalance in the microbiome, and it's related to which actually, people don't realize the oral microbiome is very intricately connected with the systemic immune system. It actually compartmentalizes, stratifies the entire immune system. So if your microbiome is out of balance, it affects not only oral immunity, but systemic immunity as well. And that's why I spent 20 years, and I don't know if you've used this. Have you used this? Because this will help your geographic tongue. And when the oral microbiome is, I know this is like, sorry about that. Anyway, when the oral microbiome is in balance, which is all I've cared about for the past 20 years, you do not get a high film thickness. You do not get a thick, sticky, smelly film. So 10 years ago, when I did focus groups with patients in Chicago, Atlanta, New York, and one other place I forgot, over 60 people tried using Revitin, and what they found in a number of days that they'd wake up in the morning and their mouth felt, and they used this expression several times, squeaky clean. And it was squeaky clean because of a reduced film thickness. So a balanced oral microbiome is a thin, clear, odorless film. When the microbiome is out of balance, you are constantly swimming upstream, which is why I see people oil pulling, which I'm not against, but if your microbiome's out of balance, it'll help for a little bit, but then it could strip things. Tongue scraping, yes, Ayurvedic background. If your microbiome's out of balance, you're going to need to use it a lot. So balancing the microbiome is really a root cause thing. And for me, and I just, did a very large randomized double-blind clinical trial just to see if this formula created an ability to promote, to create a low film thickness. And we came back that we reduced alpha diversity, more aerobic microbiome, and that's why people's mouths feel cleaner in the morning, because we're doing what the body wants. And in naturopathic medicine, we know it's not about the seed, but it's about the soil. It's not about just killing bugs and trying to scrape and get rid of stuff, but about really making sure that the soil and the terrain is in balance. And that's where I think everyone's focus should be.